Hello, I'm Tony DeMaria, the editor of JACC, here with the highlights of the May 1st issue. And there's a number of really good articles in this issue, so I'm just going to tell you about them very quickly. The first study comes to us from the Emphasis HF, or heart failure study, that tested the application of eplerenone to antagonize mineralocorticoid receptors in patients with heart failure. In this particular paper, they look at the ability of eplerenone to reduce the incidence of atrial flutter fibrillation. And in fact, what they observed in the Emphasis trial was that eplerenone was successful in reducing the incidence of new AFib flutter from about 4% to about 2% in the treated patients. However, this didn't affect the overall ability of eplerenone to produce a clinical benefit, so atrial fib flutter didn't seem to be the mechanism. A study from the Cleveland Clinic utilizing intravascular ultrasound reported that spotty calcification by IVUS was a strong marker of increased plaque volume. In addition to that, the response of plaques with spotty calcification to statin therapy was less marked. So spotty calcification may be a useful marker for studying atheromas. We have a study relating to myocarditis and magnetic resonance imaging. And in this study, patients with biopsy-proven myocarditis were followed over a period of over 4.5 years to try to identify prognostic markers. And the key message here is that late gadolinium enhancement was a stronger marker of prognosis than left ventricular function, EF, or ventricular volume. So another role for magnetic resonance imaging. A useful study dealt with the application of FDG PET, positron emission tomography, to identify infections of implanted electrical devices. And in this study, what they demonstrated was that, in fact, there would be accumulation of FDG PET on infected electrical devices, pacemakers or defibrillators. In patients who had recent implantation, it was a little bit of accumulation, always around the connection point. So that, in fact, we have, again, another potentially useful technique for those patients with implanted electrical devices that have fevers where the question is whether or not the device itself is the site of implantation. And the last study to tell you about tested the concept that a metabolomic profile could be identified by nuclear magnetic spectroscopy in the blood of patients with myocardial ischemia. And they studied patients who had myocardial ischemia both at the time of angioplasty and spontaneously in the setting of clinical chest pain. And they were able to identify what they called the biosignature, or think of it as a metabolic fingerprint involving a number of metabolic products that were abnormal in the setting of myocardial ischemia. And so it's possible that in the future, this metabolomic biosignature will be a very effective marker in identifying myocardial ischemia, an issue just chock full of potentially very important clinically relevant information. For Inside JACC, I'm Tony DeMaria.